Well, what we can say is, yes, there's been a sharp surge in coronavirus cases every day. The hospitals in the national capital are overflowing. All in a bid to ease the burden, many private hospitals have now started home isolation facility to prevent overcrowding. And it's imperative to put this out there that not everyone will need hospital care. Actually, if you look at even figures, most people would just need to recuperate if they've contracted the virus in their own homes. Take a look at this detailed report.
Fast running out of beds as coronavirus cases spike in the national capital region. Several private hospitals in Delhi and its suburbs have started home care facility for patients with mild symptoms. The home care package launched by Max Healthcare is priced at Rs 5,000 without a blood pressure machine and Rs 7,000 with it for a period of 15 days. Fortis Healthcare's home care plan is priced at Rs 6,000 for 17 days. Medanta has launched home care COVID packages which start from Rs 4,900 and go up to Rs 21,900. The recovery package provided by Max Healthcare includes a vital monitoring kit. It includes a digital thermometer, an oximeter for measuring oxygen levels in blood, and a digital blood pressure monitor. A doctor reviews the case with the patient every few days. A nurse calls the patient twice for monitoring vitals, follow-ups, and feedback.
Our home care packages are basically designed for those COVID-19 positive patients who are asymptomatic or have mild symptoms. They're also provided a list of do's and don'ts and a chart for vitals monitoring.
Fortis Healthcare package includes a boarding call by trained corona assistant on how to implement home isolation protocols. App-based self-reported inputs to check temperature, heart rate and symptoms. 4 doctors consult, including a psychologist and a dietitian.
Fortis and some of the other private players as well have actually launched home isolation packages. After that, there is an onboarding that happens, would explain the do's, the don'ts, what to do to the family as well as patient. And then there is an app in which their parameters can be recorded and remotely monitored by a team of paramedics and doctors who are sitting at the back end.
The home isolation facility could be a great help for several patients, as nearly 80% cases in India do not need hospital facility as per the government guidelines.
मैं पर्ल कोट रामपुस्तक सोसाइटी में रहता हूँ। मेरे सोसाइटी में कोरोना का पॉजिटिव केस आया और उन्होंने हॉस्पिटल जाने का बहुत ट्राई किया। जब बढ़ते हुए केसेस के कारण उनको हॉस्पिटल जगह नहीं मिली तो उन्होंने होम क्वारंटाइन रहने का फैसला किया। तो मैक्स हॉस्पिटल के द्वारा उनको बताए गए प्रिस्क्रिप्शन के थ्रू, डॉक्टर्स के बताए गए प्रिस्क्रिप्शन के थ्रू उन्होंने अपनी इस कोरोना काल की लड़ाई को घर रहते हुए ही अपने कोरोना पॉजिटिव से नेगेटिव होने का सफ़र पूरा किया।
Most of the hospitals are saying this will help in reducing the crowding in hospitals, and it will also make sure that the fear that people have with regards to hospitals while entering hospitals is reduced drastically. It's not just Max but other hospitals also who have come up with these mini packages. This is Aishwarya Paliwal reporting for India Today with camera person Vinod Kumar.
All right, so at this point of time, when we've seen a huge spike in cases, especially in cities like Delhi, in cities like Mumbai, you out there with people who are watching the show, many of you would want to tune into this, because one thing we want to put out there, it's data-driven analysis which has made the government suggest that 80% of cases, and that's a whopping amount, 80% of cases do not need hospital care. So if you have out there tested positive for coronavirus, you don't really need to rush to a hospital if you're asymptomatic, or even if you're mildly symptomatic. You can just take care of yourself at home, and you could do so by specialized home care offered by various hospitals. So you still know that you're being taken care of medically and you're not just self-medicating at home. I want to connect right now. We're going to be joined in a short while by Dr. Vishal Sehgal, MD Portia. He's going to join us in just about a bit. But I do have with me Dr. Ritu Garg. She's the Zonal Director, Fortis Memorial Research Institute. And, Dr. Garg, right at the onset, I want you to speak to our viewers directly on what is the benefit of home care. Because, there's a sense right now of panic that if you're if you have coronavirus, then you immediately need to try and get a bed in a hospital. Can you dispel this myth?
Yeah, hi. So as you rightly said, 80% of patients actually do not need hospital bed. We are all seeing that hospital beds have actually become a precious resource, be it public, private. And it's very important that we triage patients, and only those patients who really need admission and oxygen and have comorbidities, they get admitted. Most of the patients actually, are asymptomatic or have, let's say, a mild cough and fever, very mild fever. Having said that, there is of course a lot of anxiety and panic and what to do. So initial instinct for a lot of people is to actually rush to a hospital. But now I think in the comfort of home, they also have the assurance that they're not on their own, that there is somebody monitoring their vitals, that they will be able to know when and if they need to report to the hospital, or if what are the critical alerts when they really need to go back to the hospital. I think it's a win-win. It's a win-win for everyone. For people at large, they can be comfortable at home, they can self-isolate at home, as well as for largely community and hospitals.
All right, stay with me, Dr. Ritu. I want to also connect. We have Dr. Vishal Sehgal, MD Portia, as well with us. Dr. Sehgal, just to get you up to speed with what we were discussing with Dr. Garg, is that right at the onset, it needs to be made clear, and we have to keep reiterating the fact it's not, home care is not offered because there are no options in terms of beds in hospitals, but primarily that's the right way to go for most of the patients medically. Is that the advice that you would choose to give?
Yeah, hi, good evening. Yes, absolutely. We all know that 80% of the COVID patients are either asymptomatic or mildly symptomatic. And this is the category which can be treated or can be managed at home. They do not need to go to the hospital. So we in Portia have tied up with Government of Delhi and Greater Chennai Corporation, and we are currently managing over 20,000 COVID positive patients with mild symptoms and asymptomatic patients. Now these are being managed as per well laid down medical protocols, and also being managed by professional healthcare workers and doctors round the clock. And yes, like I said, home management is the place for them, and definitely not hospitals. We need to have more sicker patients in moderate category and severe category
Right.
treated in the hospital.
All right. So, now let's get to the second point, because if you're asymptomatic, mildly symptomatic, then stay at home, get treated at home, and you have various medical units who are going to assist you through that home care by, say, leading hospitals as well. Dr. Ritu Garg, so now if a patient is corona positive, that patient wants to get home care. How does that patient go about it? How easy it is to actually get home care? And is it all remote, or you might have, say, nurses or say some doctor coming and checking up on that patient once in a while?
So it depends on the need. So typically what we do in our hospital is, let's say if there's a patient who's come in OPD and who's tested positive, we do a proactive calling to the patient's family, and we organize a video consult because it's extremely important for us to make sure that, patient is not high risk. So we have to obviously make sure that age is on the right side and there are no comorbidities, and patient is low risk and actually can be recommended home isolation. There are very clear guidelines, and that guidelines and triaging has to happen with a video consult by a senior clinician. Once the senior clinician has assessed the patient and has said that, okay, this patient is fit for home isolation, that's when the onboarding happens. We have a full team which is working on it, and we just connect with the patient and onboarding happens automatically. So it's pretty smooth. If patients have tested somewhere else, then also they can call the hospital, and there is a separate helpline for home isolation, and that is given.
All right. So even if a patient is tested in a private lab, if a patient has tested positive, let's say in a private lab, and would want to, get home care by, say, your hospital, he can access that home care.
Yes. Yes, okay, he can. So
Dr. Garg, that prompts me to the question I asked you earlier, and I want to, go across to Dr. Sehgal as well on this. But Dr. Garg, so is it all remote? Is it that everything is online, or if need be, if I just, for self-assurance, want to see a doctor who comes and checks in on me once in a couple of days, is it possible?
So It is possible if it's really, really required. We obviously, see whether there is a need. If it is need, then of course we will organize that. Having said that, that's a little bit difficult and challenging to do. So much of it is remote, but there are people who, let's say, need caregivers. They're alone, and even they're home isolating and they need some help. In that case, we can organize and help some caregivers who can go to their homes.
All right. So if somebody is alone and self-isolating and reaching out to you for, these home care, you will be able to send somebody as a caregiver.
Yes. And that actually happens through a lot of these home care health companies only, like Portia. Vishal is here anyway.
Right.
And there are some other companies as well. They help us with that.
Okay. All right. So lots of questions and we want to, go through as many questions. So I'll go back to, Dr. Vishal Sehgal, who's MD Portia. He's also with me. Dr. Sehgal, once again, how do you decide that Dr. Garg gave us that there is a clear protocol to decide whether you're fit for home care or you need to approach a hospital. So is there an age on it, is there an age limit that from this age to this age you can be okay if you're home? Comorbidities, what if say, there is somebody who's young but diabetic, can that person take home care?
Yeah, so there are clear-cut guidelines, and like I said, very stringent medical protocols that are being currently followed, and these protocols are not only based on the clinical symptoms presentation. So a patient may not be having, or maybe having just mild symptoms, but yet may have some comorbidities like, chronic heart disease or diabetes or chronic kidney disorder or respiratory disorders. So is that patient a fit for home care? No. As per the laid down guidelines, they are very clear on the age, comorbidities. So patients under 10 years of age, over 60 years of age are not the right fit for being taken care of at home. Also,
they're asymptomatic, doctor, I'm sorry, even if say they are asymptomatic, somebody who's say between the age group of 50 to 65 has mild comorbidities, let's say somebody is a borderline diabetic, still not fit for home care, will have to approach a hospital?
No, so those are gray areas. So, there's a consultation with the doctor that happens initially, and if it's a borderline diabetes, well under control, can be taken care of at home. But otherwise, full-blown diabetes and, age over 60 years are not the right candidates. Also, I may add, not only, like I said, not only the clinical symptoms, there are 3 other mandatory requirements for, home isolation. One is there should be an available single dedicated room for the patient, which only the patient will, stay in. There should be a dedicated washroom or a bathroom for the patient, and there should be a care provider 24/7. Now, this care provider should ideally be between 20 years of age to about, 55 or at the most 60 years of age. Only then can they get into home isolation. Otherwise, even they may be asymptomatic, but if they don't have a, dedicated room caregiver, they are,
So, in cities, especially Dr. Sehgal, you have a young population, most of them are living alone. So what happens there? So if there is, say, somebody who's between the age group and certifies at every level but doesn't have a caregiver, then what does that person do?
So they, if it's a couple, then the spouse can be the caregiver. If someone from the family. If not, then ideally they should be moved to a hospital. Those are the guidelines, and that is what we do.
Does your company provide caregivers?
Yes, absolutely. So we provide everything from caregivers to nurses to doctor visits. That addition. That's
so if there is somebody who's living alone, tested positive, mildly symptomatic, but fits every criteria of home quarantine, can approach Portia and they'll be able to get a caregiver.
Yes, absolutely. So as we speak, there are a lot of patients where we are providing caregivers for such patients. To take care of the patient at home.
All right. Before I close this edition, because it's been highly informative, Dr. Sehgal, I'll ask you how many patients do you have in your care right now in terms of who you're giving home care to?
Right. So currently Portia has the highest number of patient numbers being taken care of at home. So we have more than 20,000 patients in Delhi and Chennai through the government tie-ups. And every day we are adding between 1,500 to 2,000 patients. So in another week's time, it will cross 30,000. And we are also in discussions with various other state governments for a similar tie-up for their, home isolation program.
that number is mind-boggling if you just look at it in terms of the positive cases. But
and not only that, sorry, I may add.
Yes.
We've been doing this for the past 6 weeks. 4th of May we started. for Delhi, and we've discharged 40% patients. So about 8,000 patients have been discharged after completion of isolation, and they are perfectly fine.
Well, good to know, good to know. Dr. Ritu Garg, how many patients right now in home care with you?
So very few, because we just rolled it last week, because it started with Gurugram. So we have got around maybe 50 patients who are enrolled within a week. So the program started with Gurugram, and now we are rolling it pan Fortis across the cities.
All right. Dr. Sehgal, do you send doctors home?
Yes, we do send doctors home but for mild and asymptomatic patients, it's usually through teleconsults or video consults, and we've seen patients are not really asking for physical visits of the doctors, so it's being managed. But if required, yes, we can send.
You will send. All right. Okay. Appreciate you both for joining us, and I would just reckon that a lot of questions were answered for people who might have just tested positive or who would possibly test positive in days to come. That don't quite worry. Once again, what we started this bulletin with, 80% of people who test positive for coronavirus do not need hospitalization. You can stay at home and possibly subscribe to any medical facility for home care. With that, it's a wrap on this edition of news. Thank you for watching.